During this module, we will discuss what occurs in a genetic counseling session, what to expect, and what you can do to prepare for your appointment. First, we will talk about the general layout of a genetic counseling session. Next, we will elaborate on what information is usually important in an appointment and how you can better prepare to answer questions about your personal and family medical history. Third, we will prepare you for some sensitive questions and topics that you might encounter during your session and explain why these topics are important to cover. Lastly, we will teach you about what informed consent is and how you and your GC should provide you with all of the available facts and options so that you can make an informed decision. Session outline. It is important to note that each genetic counselor is unique in their style and preferences when counseling. So, this layout may vary depending on your genetic counselor and your reason for the session. When first coming into a genetic counseling session, you will either be in a medical office or you might attend the appointment virtually. Regardless, at the start of your appointment, you will be introduced to your genetic counselor. Your GC might then explain the layout of how they usually run a session. This is when you can talk about what is most important to you for the appointment and what you would like to get out of today's session. You might also be asked about why you are attending the appointment, whether that's because you were referred by your doctor or because you felt it was necessary and important to see a genetic counselor to understand your risks. Next is information gathering. During this section of the session, your GC will ask questions about your personal medical history and your family history. This will help your GC to get a better overall picture. Depending on your reasoning for the appointment, your GC will also explain all of the options that are available to you, whether that's genetic testing, diagnostic testing, screening and monitoring, different pregnancy outcomes, or treatment discussion. If you are at the appointment to receive test or screening results, these results will be explained prior to talking about all of the available options. This is a great opportunity in the session to ask about any questions you might have. Finally, you and your GC will come up with a plan for what works best for you and your family. This is a collaborative process. Although if you are unsure about what you would like to do, you can always decide to take time outside of your session to think it over. At the end of the appointment, your GC will recap what was discussed and will explain what the next steps will be.
Next, we will be going over how to prepare for your first genetic counseling session. For information gathering, important things to prepare for a session would be information about your personal history, your medical history, your family history, and any other pieces of information that you think might be relevant to the session or any concern that you have going into the session. Be prepared to answer questions about your personal life in terms of lifestyle choices in your job. These questions will be asked so the genetic counselor can gauge who you are, what's important to you, and if you have been exposed to any teratogens or carcinogens, meaning things that could negatively affect your health. You will be asked general questions about your medical history. Some will be to confirm the information that we already have on your medical record, and others will be asked that will gauge specifically why you've come into the session. For example, if you're coming into a prenatal genetic counseling appointment, we will ask you questions about any medications that you're currently on, how old you are, how far into the pregnancy you are, if this is your first child, and if you've had any complications in your pregnancy thus far. Be prepared to answer questions about your family history. Your genetic counselor will need to ask you these questions to learn about the medical history of your family members to see if there are any patterns or trends running through your family that might need to be addressed specifically. Make sure that you know medical history of your family members dating back to your grandparents. This information will be important for pedigree making, which is something that your genetic counselor will be doing as you are discussing your family history. For example, if you're going to see a genetic counselor for cancer, they might ask if you or anyone in your family has ever had cancer, or how old they were when they were diagnosed.
Another important part of preparing for a session is to think about sensitive questions that will be brought up. Questions regarding race, ethnicity, and religion will most likely be asked. The reason for this is because certain genetic disorders are more common with certain ethnic groups, religions, and races. Inquiring about these backgrounds can also reveal helpful information for diagnosis. Some questions to expect include: what is your ethnicity? What do you believe your race is? How important is religion in your life? And do you have any parts of Ashkenazi Jewish ethnicity in your heritage? Counselors may also ask about towns, cities, and countries that you come from. Some other sensitive questions to be aware of may relate to consanguinity. Consanguinity is the union between two blood individuals who are related as second cousins or closer. In a session, the genetic counselor may ask you if you and your partner are related in any way. Since relatives share a lot of the same DNA, there could be a higher risk of autosomal recessive disorders, which is a specific way of inheriting traits based on receiving the same genetic changes from both of your parents. By asking this question, the counselor is trying to get a better understanding of your family. Expect questions including: is there any chance you and your partner are related by blood? Is there any chance your parents or grandparents might have been related by blood? In the case of consanguinity, the counselor may also ask questions to learn exactly how you and your partner are related. For example, being second cousins versus first cousins once removed, because different relationships change the amount of DNA you share. Here too, you may be asked what cities, towns, or countries you and your family come from. With all types of sensitive questions, it is important to remember that the counselor is trying to gather as much information as possible to understand you and your background and the implications they have on your health. By no means is the counselor trying to be offensive.
Informed consent is a major part of the genetic counseling session. Informed consent means that your genetic counselor educates you about the pros, cons, and alternatives that may lead to genetic testing. It's important that you understand, as the patient, the necessary information you need to make the best medical decisions for you. There are many steps in the process of informed consent. Above all, your genetic counselor should discuss all the different options you as a patient can pursue. Additionally, the genetic counselor should explain all the probable pros and cons to each option. In taking these steps, a conversation between you and the genetic counselor can allow for an informed decision to be made. And of course, remember that above all, genetic counseling is all about finding the right choice for you and your family. There is no right or wrong choice, and you can always change your mind and pursue different paths at another time. Again, the final decision is up to you. Any type of genetic testing you have done must be agreed upon by you. And remember, you can change your mind at any point. Thank you for watching. We hope you learned more about the genetic counseling session in today's video.